So I'm going to introduce you, Jackie, now because you're going to be the speaker for the next 45 minutes. Um, so let me just. So Jacqueline Vachon is Associate Director of Dialogue McGill. She worked as a psychologist in the healthcare system in the US and in Canada, providing neuropsychological assessments and therapy. She has several peer reviews publications in various fields, and she has over 10 years of research management experience at universities and hospitals, including Yale University, University of Minnesota, and McGill University. And Jackie has been very diligent in learning as she just came from the US a few years ago. She's been really uh, doing great progress in learning French and using French. So welcome, Jackie. And you're going to talk to us today about Dialogue McGill, its current initiatives and future directions.
Merci, Carmen. I'm going to share my screen now. Voilà. Did that work?
Yes.
Okay, great. Oui, bonjour. Je suis directrice.
Hello. Like we said, I'm a director for Dialogue McGill. As Professor Loisel explained, I have immigrated to Canada a few years ago, and before that, I understood only 5 French words, so hello and the day's menu. So not a very extensive vocabulary for working and living in Quebec, but thanks to a lot of patience from Professor Loisel, and thanks to programs such as Dialogue McGill, I am learning French a bit by bit.
So thank you for your patience with mon accent American. So today I wanted to talk about Dialogue McGill. And as I'm speaking French, I'm thinking back to Dr. Andrew Ryder's talk, which was included comments on second language anxieties. And I definitely can understand that when it comes to public speaking. I think one of the things we want to do at Dialogue McGill is to make people very comfortable approaching our team. We have a bilingual team, so please feel welcome to email us in either official language of your choice for whatever services you're interested in receiving. We also have a few people who speak other languages as well. I think we have a Spanish speaker, somebody who speaks Mandarin. So if you have a different language, we might be able to accommodate that. We'll see. So we have a fairly new Dialogue McGill team, although Dialogue McGill has been around, as many of you know, since 2004, and we'll get into the history in a minute here. But Dr. Loisel actually joined Dialogue McGill 1 month into the pandemic, so not an easy feat. And then I joined as Associate Director 1 year into the pandemic back in April of this year. And one of the things that Carmen and I continue to be very impressed with is the resiliency and the innovations that our funded partners have come up with addressing issues during the pandemic, research during the pandemic, moving language courses online in a very quick and efficient manner. So that was one of the things that really struck me when I first started at Dialogue McGill was this innovation of our different partners to work with some very difficult situations for the pandemic and continue to provide services, especially to the official language community. So today I'm going to talk about Dialogue McGill. I'm going to talk about our 3 different programs and their objectives. I'm also going to talk about future directions for Dialogue McGill moving forward. And please feel welcome to ask any questions in the chat as I go. So here's a brief overview of what my talk will be. I'm going to explain a brief history of Dialogue McGill, the 3 programs, like I said. We're going to talk about our upcoming website launch, which we're very excited about. Also, a few upcoming events that will want some feedback and buy-in from our stakeholders. And then we have a post-conference survey that I'll talk about briefly, and then I'll give some Dialogue McGill team contacts for for our different programs, and then an acknowledgement. So Dialogue McGill would not have been possible if it wasn't for Health Canada's initiative. So Health Canada came out with this great initiative where they launched the Official Languages Health Program in 2003, which really is focused on improving official language communities' access to health and social services. And so they have funded different sister organizations like CHSSN, SSF. I think many representatives from those different groups are here with us today. And so the Vachon group, which is the bureau that specifically handles this very large program, has some information posted on the Health Canada website. I included the link here, and maybe Jonathan, if you don't mind putting that link in the chat as well. So Dialogue McGill became a funding recipient back in 2004. We went by a few different names, is my understanding. A very long name, training and professional and recruitment of retention of professionals. So there was a kind of a revamp. So now we're just Dialogue McGill, nice and simple. And that's where we are now. So our primary objectives since we started in 2004 have really been about language training which we'll get into for professionals and for students to help make sure that we are recruiting and retaining professionals in Quebec. And we also have different recruitment and retention strategies. Some of those things have been talked about in the wonderful presentations that were given by our advisors yesterday during their symposium. So we'll go over those a little bit. We also have a research program. Now, this research program is more about providing funding support to different initiatives across Quebec to do evidence-based, to have evidence-based results about how to improve access for the Quebec official language minority. And we've actually expanded the research program quite a bit, which we'll talk about in a minute. So first I want to start with our language training program, because this is basically the biggest program in terms of what McGill has been doing up to date. We really work on providing professionals with language training. This comes in different forms, such as formal courses, online conversation courses. We also have some community networks who are doing some great conversation cafes and clubs that people can join to practice. We've had different CJEPs who have done different trainings as well, from health professionals to students in lab settings and things like that. So lots of great things going on there. We also focus on language training of students, because we really want to make sure that students feel comfortable and interested in staying in Quebec, primarily through English and French language learning, so that they can be bilingual and pass any sort of language exams they need to practice in Quebec. We also, through our language training program, we have special project calls for different new initiatives. We'll talk about those in a little bit, as well as if our répondants at the different institutions across Quebec would like to request additional funding for language training. So we have 26 different healthcare and social service institutions that receive an allocated budget each year for them to recruit and work with us to enroll different participants, so nurses, social workers, all different people who are working with the official language minority and the public in general to learn to learn English or French, primarily English in Quebec. But these partners get these healthcare and social service institutions have an allocated budget from Dialogue McGill to do these different language courses with our language training providers. And if they want additional funds, if they say, look, we have so many people who are interested, we can provide what's called a special project, which allows them to potentially get extra funding for language training activities. So as I mentioned, it's really up to the different institutions to recruit and select participants based on a pre-approved annual budget. The majority of our courses are offered through the McGill University School of Continuing Studies through what's called the Anglais Santé program. I'm sure a lot of people here have either been enrolled in the program, are working in the program, or at least are very familiar with this program. But basically, the course content is not, how can I order a cafe in a restaurant, but it's more actually Dialogue McGill worked with School of Continuing Studies to have course content specifically created that's tailored to the healthcare and social service professionals who will be taking these courses. And so we have different language levels. We have beginner courses, intermediate, all the way to advanced. These courses include 24-hour online training course modules that people can access. We also have, through School of Continuing Studies, a 16-hour complementary conversation course. And I've included the link here, but maybe Jonathan, if you can also put the Anglais Santé link in the chat box, that would be great. So we also offer through a couple of CJEPs, we have French courses. The School of Continuing Studies also does some French courses as well, both for healthcare and social service professionals as well as students. We'll talk about those in a few minutes. And basically, each of our language programs have it where somebody would take a placement test to see where their level of fluency is, and then they would be recommended on which course would be appropriate for them. One of the things that Dialogue McGill has talked about with our advisors is potentially having kind of a guide for the different students in these programs in terms of what fluency level they need to be based on their question. And we actually got a very interesting project proposal from Anne Martel about that we'll talk about in a few minutes here that we're excited to work on, which is basically focused on evidence-based matching of what a profession needs in terms of language fluency, because a nurse is going to have a different fluency level that's necessary as opposed to a front desk worker. And I think Andrew Ryder and maybe a few other people have talked about how there are certain professions where, you're as a professional, you're just not comfortable talking to somebody in a therapy setting, myself included. I wouldn't be comfortable speaking in French in a therapy setting, but I might feel comfortable having a day-to-day conversation with a person. So if there are any people here who are interested in these kind of courses or interested as an institution to see if you're eligible to receive funding from Dialogue McGill to implement this program at your institution, you can contact the Dialogue McGill team, or you can contact your direct manager about enrolling in a course, and the direct manager or the respondent would need to contact their human resources department about this. As I mentioned, we also have different conversation groups. We have 23 community networks that we work with, and a good chunk of them are working on different initiatives in this domain. We have our language training program specifically for McGill University students, and this offers different workshops. So one of the things for our outside of Quebec attendees is in Quebec, we actually need to have people take English and French exams, typically, language exams, to see if they're eligible to actually be licensed and practice in Quebec. And so the language training program here is the French Language Center courses are being offered to McGill students right now in order to make sure that they're prepared for their exam. We also have French language courses in addition to these workshops for exam preparation. All of these things are being offered by Dr. Ariel Mercado. I think I might have seen his name earlier at some point during the conference. So I included his contact information here, and he's the person you would contact as a McGill student to see about your eligibility and enrolling in these programs. Okay, so going back to the School of Continuing Studies, our English language training program with the School of Continuing Studies is our largest program, largest funded program by Dialogue McGill. I've included some numbers here. I love numbers. And it includes what our course enrollments have looked like since for our current funding phase with Health Canada from 2018. And we just got, I don't know if Ron is in attendance from School of Continuing Studies, but he sent me an email last night. Woohoo, you know, here we are with our numbers for 21-22 for enrollments, which is nice and high, 1,681. And then for completions, of course, we don't have our period 3 completions because it's just starting now. But you can see that our projections are about 1,311 people will have actually completed the English language training course. We also have funded, Dialogue McGill has funded these different special projects, which are, like I said, they're focused on language training activities or providing additional funding to our different healthcare and social service institutions. This year we did, well, Daksha and I did a number of special project calls. So thanks to Daksha for helping me with all those calls for this time around. And we did get 10 special project applications, and a few are pending, but the others have been funded. In addition to the formal language training, we also have different activities for healthcare and social service institutions. So for example, we had, I think, 4 or 5 different community networks just in the last, for the last 2 periods, so April to November, who held different conversation clubs on a regular basis. And we had a total of 50 attendees for these. So 50 people from the healthcare and social service professions. And we also have English language training activities for French-speaking healthcare and social service students. So I'd like to acknowledge John Abbott College and them having done 142 nursing students receive French language training, French language skills mentorship during a lab scenario by a nurse. So I think that was this is one of those innovative strategies for engaging the community and our students. For the French Language Center, or actually this is School of Continuing Studies French language courses. You know, Verena is our person who's tracking and sending us these updates, and thank you, Verena, for sending this. We just closed out our period 2 reporting period, so we just got this. And so we're primarily focused on English language training because that is the minority language in Quebec. But we realize that there are people, healthcare and social service professionals and students who would be more likely to be retained in Quebec if we offer a minority of French language training as well. So we have opened it up to that. Okay, so here are the French Language Center training courses that we talked about. These are the courses that Dr. Ariel Mercado is now working on. And you can see our numbers so far. Keeping in mind, I put a little asterisk for 2020 to 2021 that during a pandemic, it's a little bit more difficult to enroll in courses, but we seem to be doing pretty well overall. One of the things we'd like to do for the language training program is get a better sense of, okay, here's what we've been doing so far. Moving forward, what should we be focused on? Are these language courses really having the impact that we want? Are there suggestions both from community networks, Répondance, the ministry? I think I saw Ange as our ministry representative. And identifying what positions are most in need of bilingualism so that they can be also targeted. We have different bursary funding calls that include a question to our community networks, for example, saying, okay, well, for the bursary program, what healthcare or social service professions are really in need in your community, and getting that feedback both at the ministry level as well as at the community level is very important for informing our programs. So we're going to talk about some different events we'll have to gather more information on that. We also want to make sure that we do develop evidence-based guidelines for language fluency for each position. We had Anne Martel reach out to us about working with our research team to really develop some sort of guidelines that we can give out across our 26 institutions across Quebec, to give them guidelines for saying, here's what the evidence seems to say in terms of what language level is needed for this type of provider, and here's how it corresponds to the language courses that we're providing through Dialogue McGill and School of Continuing Studies and the CEGEPs. So we're working on this to have kind of a nice little package for each of our institutions to help inform them moving forward. And then of course testing to see, after we give these kind of guidelines, do we need to tweak things? Does this seem to be meeting the needs? We also want to have a forum with our répondants and working with, of course, the Ministry of Health and Social Services. We also have some different language training resources online that we'd like to update and compile and make sure they're digitized instead of just having kind of hard copies that we send out by mail. So moving forward with this, and also figuring out kind of how to focus on different apps maybe and things like that, and testing those and developing those in a way where they're publicly available that also could supplement language training. So our primary contact would be Daksha. She's our project officer for the language training program. So I included her email address here. You can see her friendly face. Feel free to contact her in the language of your choice at any time if you have any questions about our language training programs, and she'll be more than happy to help you. Okay. So now on to our recruitment and retention program. Our recruitment and retention program really provides initiatives for the recruitment and retention of recent graduates capable of providing bilingual services. And we also are empowering our community networks to partner with us to help recruit and retain professions in their region, and having targeted, not just a broad spread shot of, okay, we need more professionals, but rather figuring out, okay, what professionals should we be focused on? We also have several bursary programs. We have student and supervisory internship funding support as well, and a whole bunch of other funding initiatives in this domain. So just to give you some numbers or some information too on some of these programs, is we have each year we have around 50 students who are awarded Dialogue McGill bursaries in exchange for 1 year of committing to working in the public sector at CUs or CIS post-graduation. This has been a great program. We are going to do some updates in terms of tracking for this. But the community networks have done a fantastic job. I think we got probably some of the highest numbers of applications in 2021. And thanks to Richard and Gail and Andrew as well. He helped quite a bit with streamlining the application process for our community networks. So we're keen to hear back from our community networks to see if having one deadline per year, one application package, as opposed to 3 different deadlines and application forms. So we'd like, if community networks are comfortable giving us our feedback on the one time per year, and if that timing also seems to work well with your current priority areas. So these 23 community networks work with our 26 Quebec-based institutions, and they do a fantastic job, like Gail and Richard had talked about, with having an updated student data bank, assisting with post-graduation job placements, and a lot of other good work in this area. So our community networks are actually the ones who recruit the different students for our bursary program. They review the applications, they write recommendations for students, and then they submit these applications to Dialogue McGill. I think we received maybe 68 this year, and Dialogue McGill has a review committee, in which case we review these applications and award as many bursaries as we can afford for appropriate students for this program. We also have a targeted bursary program. Now, this targeted bursary program, we noticed that there's really a high need for speech language pathology students to stay in Quebec. So we have a program specifically dedicated to this profession for bursaries. And a call out to Lauren at McGill's SCSD school, because she does a fantastic job sending us all these materials and compiling them with her team. We also have different educational projects. Educational partners and other actually community-based organizations like Vachon that Jean had talked about yesterday. They can apply for projects focused also on the recruitment and retention of professionals. And these educational projects also can have a language component as well, such as English conversation cafes. Professor Caroline Storr is our chair for the Dialogue McGill's Professional Schools Committee, and this is a great committee that provides a forum for discussions on these different projects, determining student retention needs, and then communicating this with the Dialogue McGill team. And then in turn, Dialogue McGill will inform the committee about different upcoming funding calls that we have so that they can be distributed across the different programs. We're currently seeking a psychology faculty representative for our group. So if there's anybody who's a faculty a psychologist in a faculty position or knows somebody who might be interested, please give them our contact information. We'd love to hear from them. Okay, so we also have an internship support program where we provide funding for students and supervisors for clinical internship placements. So this is really a reimbursement program. So what happens is we receive applications from different schools. So the schools are responsible for recruiting and gathering these applications, providing them with rankings, basically, and information to Dialogue McGill's team. And then our review committee again looks at these and says, oh, look at this person is going to be placed in a remote region of Quebec to do their internship, and they're requesting this amount for funding reimbursements for lodging and travel to this remote region. And then the review committee decides which applications will receive funding based on the budget for that year. Students and supervisor internship support is 5,000, a maximum of 5,000 reimbursement, as Professor Storr had mentioned yesterday. We also have community network projects in this domain where they are eligible for funding for these activities. So I'd just like to say some accomplishments we've had since April of this year up until November 30th, which is our second period of reporting. So these are the numbers. We'll see how the next 3 months goes. But we have 48 of our bursary applications were approved for funding. And again, those are bursary recipients who will be who have committed to 1 year post-graduation in the public sector. Now, students can receive, if they're interested, we can, and approved for funding, we can give more than just a 1 year bursary. So if a student says, yeah, I'd be open to committing 2 years of post-graduation service in Quebec, then they could receive a second bursary. And the bursary amounts range based on whatever their educational level is. So we have vocational, we have CJEPs, and we have different graduate programs for universities. So again, if any students are here, and this sounds like a great way to be able to support yourself financially during your education, and you want to stay in Quebec to practice, then please contact us about this, or you can contact your local community network if you know who your local community network is. If you're not sure who your community network is, one of our project officers would be happy to help you with that. We also funded 5 speech language pathology targeted bursaries this year and 14 educational and other institutions projects. So we had funding calls for each of these since April, and these are some of the numbers. And the 23 community networks have done a fantastic job with different recruitment and retention incentives. We've had 22 internship placements in healthcare and social service programs. 6 students and 2 supervisors have received internship reimbursement funding for travel, etc. And we recently discussed and are going to expand our program for internship support to outside of McGill. So, for example, we just recently had a group at Dawson's who was approved for receiving internship support funding, and we want to make this call more available, more publicized among different educational groups outside of McGill. And I think Jean will help us with that, right, Jean? Great. Okay, so future directions. Like I said, we really want to expand our different programs in different ways. So for our speech and language pathology bursary program, we want to expand it outside of speech and language pathology. We're going to retain a budget envelope just for speech language pathology, but we'd also like to look and see what other professions are needed in Quebec for retention. So right now, step 1 is we're going to open it up to different McGill professional schools. And then step 2 is that we're going to open a call to other Quebec educational institutions with English as a language of instruction. We also are currently offering we're offering translational financial support for our educational partners for activities relevant to Dialogue McGill's mandate. So we've provided some funding for that as well for this year. And we're also interested in, for all of our programs, we're very interested in hearing back to see, are these programs meeting needs? What are some ways we can develop these programs moving forward, especially as we're looking for a renewal in 2023 with our funding sponsor. So Nancy is our wonderful project officer for the recruitment and retention program. She has been very busy since she started in September with answering questions, jumping into reporting and things like that. So you can contact her if you have any questions about the retention and recruitment program directly. Yep, and we're very happy to have her. All right, so the research development program. So our research program, and Carmen, please let me know if I'm okay on time or if...
You're doing just fine.
Okay, great, thank you. So for our research program, we support financially research, and we actually are working with partners, not just supporting them financially, but also helping them to implement and have some infrastructure support for different initiatives that address relationships between language and access to health and social services. We also have student stipends that are available, and we're also expanding our research program, not just to be funding research programs, but actually working with our partners and implementing their projects and seeing what we can do internally to support them, as well as doing program evaluation and satisfaction for all of Dialogue McGill's programs. Because it's one thing to say, okay, we're going to do the language training, we're going to do these recruitment and retention programs. It's a whole nother thing to actually say, okay, is it working? And what are ways that we can improve moving forward? One of the things that when Carmen and I both started with Dialogue McGill is we noticed that in the past, Dialogue McGill has funded some great research projects. Some of the research projects didn't necessarily really meet that mandate, which is examining how we can improve access and services for Quebec Anglophones. And so one of the things we did for the funding calls for 2021 to 2023 is really get back to our mandate and making sure that it's focused on these kind of this population in particular, and offering more student stipends for research where we can. And then, of course, we have our annual conference, so welcome to that. And we'll talk in a second here about the performance evaluation piece. So key accomplishments. So far, I think we're doing okay with our conference. So I'm going to prematurely list that as an accomplishment. And then we have uh, Dr. Tyler Brown yesterday had spoken about the new recruitment and retention project, which really examines barriers and incentives for healthcare and social service students to stay or leave Quebec after graduation. And of course, these results are going to not only be communicated to all of our partners across Quebec and our sponsor, but we want to use these results to enhance our recruitment and retention program. And we're also going to use the different programs and different data that we've seen that different partners have shared during our conference, as well as John Abbott College has sent us a great report on their recruitment and retention survey and things like that. So our research program typically has one call. This call is for 2 years of funding. We decided we're going to be ambitious, and we did 2 calls this year. So the first call was for 2-year research projects and student stipends, and that funding call resulted in 4 new research projects receiving funding, and then 9 active research projects continued to receive funding. And then 4 students who I think have joined our conference, I saw a few of them, have received stipends for their research projects. And then Dr. Lozelle and I saw, you know what, and actually communicating with Health Canada, they gave us the idea. There's really a need for mental health focus. And so what we did was our second call for this year was focused on a 2-year research projects with more of a mental health focus. And so we were able to, with our budget, go ahead and go with 2 new research projects specifically focused on mental health. And one student also received a stipend for a research project in this domain. And again, we look forward to making there be a connection across our partners moving forward, instead of it being language training, recruitment, retention, and research, but really communicating findings from the research program to inform our other partners across all programs. So I already mentioned we really want to focus more on Anglophone needs in the community. We also want to do program impact and satisfaction initiative. We received some data from School of Continuing Studies, so thanks to that group for giving us some data that we can use. And then we're also in the process of Dr. Jonathan Caballero, our new research officer, is hard at work working on a performance, yeah, there he is, satisfaction initiative as well, to see about we'll be starting with School of Continuing Studies programs and the CJEP programs and French Language Center program, and then expanding across our different initiatives, such as the recruitment and retention piece, to see what kind of satisfaction people have with these services, and how we can better identify what the needs are moving forward once we submit our Health Canada renewal. So Anne Martel sent us a great project, and our research team is going to be working with her on creating these linguistic profiles for each healthcare profession and matching that specifically to the language training courses that were being offered, so that it's very clear to our 26 institutions who are recruiting the language training participants. Okay, if you're a nurse and you're placed at this level, you probably need 2 more courses, and then you'll be where you'll feel comfortable working with your population, and then testing that pre and post to see if that works. So we have some big plans for this. We're also interested in hearing feedback from researchers, community members, etc., to guide our funding calls. Also for Anne Martel's project with Dialogue McGill, if there are any institutions who might be interested in piloting this project with us, please reach out to Dr. Caballero, and he can go ahead and take your name down as one of the potential people for this pilot project. So we want to work with our partners. It's really not about us saying, here's what the needs are, here's what the evidence says. It's also about hearing back from people in the community who are on the ground, who know what works, what doesn't, who can help us on improving our programs. We also started a list of university and hospital-based researchers to be on our external reviewer list. So these reviewers will review different funding call applications that we receive. So for example, the mental health call that we wrapped up. So please contact Jonathan if you're interested in potentially joining this list, and he'll add your name. If you can also send him a little note with your areas of expertise and what you would feel comfortable reviewing, that would also be helpful for us. And there's his information. I think you've seen him throughout the conference. And Jonathan Caballero, he actually comes from a psychology background as well. So very informative with helping us with the mental health call and initiative as well. And I think it's worth saying too that Dr. Caballero really helped us with setting up this conference. So I'd like to acknowledge him and thank him for his help with this. We also have a conference survey. So maybe can somebody put that in the chat? Maybe Jonathan, do you mind putting the post-dialogue McGill conference survey? We really would like to have your feedback on how this program went. We'd also like to hear if you have some suggested topics for next year's conference. Anything else? Comments on technological issues. I talked to our tech team and they said we got one call and the person, while they were on the phone with us, resolved it within 2 seconds. So I think there weren't any tech issues. I think people are pretty comfortable with Zoom as a platform now. But if you encountered any tech issues with pre-registration or anything like that, please let us know. Or if it worked fine, also let us know. So we're launching a new website. I find the current website is not very user-friendly for new people who are new partners or new Dialogue McGill. When I joined as associate director in April, I was trying to find information on our website, and it wasn't easy. So we're going to create a new, we are creating, it's almost ready, a new website that we're going to be offering and launching, I think in February or March. I think we'll have everything there. C'est un site web en français et anglais, bien sûr. And it'll have
It's going to be in French and English, of course.
Some resources, like I said. We want to really centralize and digitize our language training resources, any other resources. I know the community networks, for example, have created some great content. So we'll work with them and see what they're comfortable with us including on our website, for example. But it will be much more user-friendly. We're also looking for people to, after the website is launched, give us your feedback. So if you're interested in that, you can also let us know if you'd like to volunteer to give your feedback on our website. So upcoming events, we have new funding calls. Like I mentioned, we're expanding our bursary, our targeted bursary call. That'll be launched on Monday. So Nancy has been working hard to update our forms for that, and Caroline Store has made an announcement to our professional schools, and so we'll be sending out an email on that Monday. We also have the new website launch. We really want to meet with our different health and social service institutions to about streamlining our language training program, hear their feedback on that. We're also going to have a community network forum series. I think that'll probably be February or March. We'd like to do it before we do the next round of bursary program, the next community network bursary program call, because we want to use the forum to inform the bursary program. Tentative topics for that community network forum will be bursary program, language activities, research needs in the community, and available resources for our partners. We also are going to send out a survey to our community networks to solicit any other topics or questions that they would like to be included in this series. So here's our team again. So please feel free to contact them at any time for any questions that you might have, any suggestions you have, anything of that nature. And I would like to say a big thank you to the Backlow team, to Health Canada. Obviously, this event, all of our programming wouldn't be possible without you. So merci beaucoup, and that's all I have for today. So are there any questions, Carmen?
Thank you so much, Jackie. You did a wonderful job over giving an overview, but also the details of each program. So this is great. So I'm going to start maybe with a question that is maybe easier to answer, and then I'll go to more complex one above that one. So Jean-Philippe Turcotte is asking, concerning the language training program, would you consider developing shorter courses? That's the first suggestion. And the second one, courses for people with less than a beginner one level.
So these are both great questions. So I think this kind of feedback is what we're looking for. So I think we'll talk with I don't know, I see Daksha's face. Daksha, can you make a note that we should follow up and discuss the piece about making the courses shorter? And the second piece was asking about having an easier beginner course. Yes. So we're aware of this. So my understanding is the School of Continuing Studies right now has a beginner program, but it's not quite beginner. So if you were like me and you spoke 5 words of French when you're moving to Canada, or English in this case, this might not be the program for you. So Dialogue McGill has to balance 2 things here. One is a question of what is our objective for our language training program? Are we looking to train people more specifically on healthcare and social service communication in the language, or from all the way from the very, very beginner all the way through? So if we reserve funding for people who are learning how to say poem and very easy to say words, it's a trade-off. And this is something that we've talked about with our advisory committee, and we actually have on our meeting agenda for next month that we'll be talking about, and we'll communicate that information shortly.
Thank you. So I'm going to call on Terry Kaufman, if you're hearing me, just because I want to make sure that we address your point. Can you come on and just maybe summarize? Otherwise, I'll read your comment. Terry Kaufman, are you there?
Yeah, just one sec.
Sure.
So my question is relatively simple, and as Sarah Bowen presented, is at the same time complex. What basically Sarah's conclusion after working at the Winnipeg Regional Health Authority is that the leadership of public healthcare systems have to understand that there's a greater cost. This was her conclusion. There's a greater cost in not providing what I classify as effective, successful communication. That if they don't do that, it's going to be a greater cost than if they do that by having either the appropriate clinicians and or formal interpreters because of extra hospitalizations, medical visits, death, an unproductive workforce, et cetera, as she described in some of her research and whatever. And what she basically showed, and I think in her last slide, was an overview of a presentation of that to the Winnipeg Regional Health Authority, which is to say, not doing it costs you more than doing it. So my question is, what are the organizations here, which is CHSSN and McGill, doing to demonstrate the clinical underpinnings and cost benefits of explaining why it's more cost effective to intervene with clinicians who speak the language of the user and or use formal interpreters than not? And I basically related to Article 1, 5, and 8 of the healthcare legislation. And I just want to say, in the global, I sit on a number of government committees, but in the context of this, the one around English language services. And so the key underpinning of our global opinion to the Minister of Health is that it's important that they use Article 1, 5, and 8 of the healthcare legislation, which describes in legislation exactly what Sarah Bowen has said, if you read those articles, in her clinical conclusions as well as the additional part of Article 15 for Anglophones, but it's not just an issue of Anglophones. So my question is, when or has this cost effectiveness been presented to government? I've never seen this. And until it's done, it's this idea of just doing alternatives, and I'm not saying they're useless, but I'm saying I'm far from convinced, as Sarah Bowen is, that it's not more cost effective just to give out bursaries to staff. The key is that the public healthcare system, it's $50 billion in this province, and it's the biggest expense in every province, that the leadership of these provincial ministries understand that it is more cost effective for their networks to take on the responsibility of ensuring effective communication than not doing it. And so that's what I want to see, if anybody has done any work in this province, and especially in these two organizations, which have a lot of money versus other alternatives, to start working and demonstrating that, because I've seen none of it. And our committee at the ministry has received zero on this.
This is, yeah, it's a very big and important topic. And I think, Jonathan, if you can make a note on this, I think one of the things we can do is we can reach out to, for example, our researchers, see what the evidence is in terms of cost effectiveness and what's been done to date on these things. And I don't know if it's actually been communicated, this information has been communicated, if it's available, one, and if it's been communicated to the proper people. So I think that's very much a big question, and it's something that could really have a positive impact across the board of Quebec if we're able to show that cost-effective ratio, a cost-effectiveness ratio. I'm happy to hear from, maybe Jennifer or Carmen or anybody who's more familiar with this field than I am, to know what the literature is.
I think that Dialogue McGill obviously has been, for years before we were even there, been investing the largest sum in language training of healthcare professionals, because it was based on some of the evidence that Sarah shared yesterday, but also, so the largest budget and the larger programs that we have at Dialogue McGill are on language training of healthcare professionals. We definitely, moving forward, I've planned and I've discussed with Dr. Bowen to work very, very closely to propose tangible initiatives to address that. So that's in the works. And the first step was to invite her in this conference and then move forward with this. So we take your comment very seriously. Anyone else would like to add something to this?
Hi, Carmen, it's Jennifer. I would just agree with Terry. I think that this is a motivating factor that could definitely help in the development of better access to services for minority language communities. And unfortunately, I'm not aware of any research that's been done in Quebec on this topic. And I believe that, Sarah's literature review probably has most of the material that's been done, and I'm sure it's been done fairly extensively in the United States. But as far as I know, it hasn't been researched here in Quebec. And maybe Jim would have a knowledge of more than I do, but I agree. I think it'd be a very, very good argument to put into the arsenal.
Anyone else?
I'll just add something if I can.
Sure.
I think, first of all, Terry, I know that you submitted quite an extensive opinion to the health minister recently that covered a lot of aspects of access, which may be of interest of all of us here to have. So if you're able to, or whatever, to forward that to us, it might be useful for us to have a community perspective that I know that you were very involved in advising the minister and the ministry on new access programs of health and social services in English. And I guess in terms of the forum or the venue, in which, these issues should be and can be and must be explored, is quite apart from research and information, whatever, to build a community perspective on this, is that the advisory structures that we have that feed directly into the service providers, regional access committees upon which English-speaking communities are the members. This is an area that should be looked at in the evaluation of services which these committees are charged with doing. The other is the guide that service providers were given to develop their access programs, and I know your committee reviewed each and every one of them thoroughly, and you've sent in recommendations to the health minister, and presumably the health minister will be sending these plans to cabinet for approval, in a reasonable period of time. There was, let me put it this way, the potential, which you are probably more likely to have seen than us, in the plans that you evaluated. So it'd be very interesting to know what you evaluated in this particular question you posed to us. And you may actually be in a better position to inform us on how you approach these questions in your approval and recommendation process. So if you have information you can provide us on this, this could stimulate, our role in terms of adding our shoulders to the wheel of improving access.
Thank you very much. I'm just looking, mindful of the time. There's one more quick comment by Marie-Brigitte that maybe Dialogue McGill could be part of la table régionale de concertation. So we're going to take note of that, Marie-Brigitte, and we're going to get back to you. So Jonathan or Jackie, if you want just to take note of this, that would be great.